Today we have Andrea Pusic online. Andrea is a plastic surgeon from Memorial Sloan Kettering and the Cornell University in New York City.
So I'm very pleased to be talking today about the breast Q and our work in breast reconstruction. For many years, when we looked at our outcomes in breast reconstruction, we considered primarily the surgeon's perspective, which is things like thinking about complications or what our photos are about. And while that's still very important, we're increasingly aware of the importance of patient-reported outcomes. In breast reconstruction, there's a lot of aspects of the outcome that only patients can really know and we can only appreciate when patients tell us. So these are things like patient satisfaction, quality of life, and in quality of life, we can think about things like physical well-being or psychosocial well-being, sexual well-being. We can also think about some of the adverse effects of treatment, like pain or discomfort. And we can also think about the process of care and satisfaction with the experience of care. So we developed the breast Q in about 2009, and I won't go into all the details of the development and how this was developed, but just to give you a sense of the scope of this project, this took us, just the interview portion of it and developing the content was 2 years. And through that process, we had help from over 2,000 patients. And subsequently, the breast Q has now been validated in a sample of over 10,000 patients, and it's been translated and linguistically validated in about 20 languages. We developed the breast Q using something called rash psychometric methods. And this goes to the idea of it being a measurement tool. And we think of these questions as essentially notches along a ruler. And the way patients answer these questions get summed together, but it helps us understand where they sit on the ruler. So as an example, the first question in this scale is, how do you look in the mirror with your clothes on? The question at the far end of the scale is, how do you look in the mirror unclothed? And so even among my perhaps most satisfied patients, some may not be able to tell you that they're very satisfied naked standing in front of the mirror. That's essentially kind of the higher test. And the other questions on the scale are kind of layered in between. And so how patients answer these questions allows us to really understand where they sit on the rash ruler. And that is summed, as per all our scales, that response is summed on a 0 to 100 number, with a higher number meaning either higher satisfaction. And then they're asked to complete the breast Q electronically online at various intervals. And what this does is it creates reports that my nurses can review and that I review when patients come into clinic, and it allows us to essentially kind of understand how patients are doing over time. This would be an example of how our nurses, our physical therapists would review this kind of information and be able to intervene. Perhaps this would trigger a referral for pain management.